Next session about cardiovascular clinical pharmacology, generic brand name, drug category, pharmaceutical form, and dosage will be drugs used for hyperlipidemia, or another maybe title drugs used for dyslipidemia. And here we have list of medication according to the category. We have it on the next slide. Okay, so before we go on the PowerPoint slide, we have the PDF file here to explain the version of the drugs used for hyperlipidemia. We have HMG coenzyme A reductase inhibitor statin. As you can see, it's here. We have atorvastatin, Lipitor. We have flovastatin, Liscol. We have lovastatin, betavastatin, Livalo. We have bravastatin, Bravacol, rosuvastatin, Crystal. Then we have simvastatin. We have cholesterol absorption inhibitor, ezetimibe, zetia tablets. Then we have bile acid sequestrant, colicivilam, colestibol, cholestyramine. Moving to the new generation of antihyperlipidemic or dyslipidemia, PCSK9 inhibitor. We have erlokumab, Broluent. Then we have evolocumab, Repatha. And this medication considered like monoclonal antibody subcutaneous injection. ACL inhibitor, we have bempedoic acid, Nexletol, bempedoic acid. MTP inhibitor, we have one medication there, oral capsule. We have lumitabid. Fibrate, we have gemfibrozil, fenofibrate in the clinical practice. Niacin is like the withdraw or like obsolete from the clinical practice now, according to the new guidelines. Niacin, we have niaspan. Then we have omega-3 fatty acid. We have Lovaza, and we have other maybe Lovaza and other medication. We have Vaseba, isosabint, ethyl. Okay, so this is what we have for the medication used for the hyperlipidemia, dyslipidemia, as you can see it here. So maybe return to the PowerPoint slide to discuss some maybe important medication in the clinical practice for the dyslipidemia and hyperlipidemia. As you can see here, we have atorvastatin, Lipitor, atorvastatin, the brand name Lipitor, belong to the HMG coenzyme A reductase inhibitor. All the statin work on the same mechanism, as you can see it here. Okay, so they work on the same mechanism. We use the statin for the primary and secondary prevention of cardiovascular event, hypercholesterolemia, hyperlipidemia. Atorvastatin available 10, 20, 40, 80 milligram. Then we have rosuvastatin, brand name Crystal. That belong to the same group, HMG coenzyme A reductase, hypercholesterolemia prevention, and familial hypercholesterolemia, available as tablet 5, 10, 20, 40 milligram. Simvastatin, Zocor, brand name Zocor for simvastatin, the same maybe clinical use for simvastatin we have available as a tablet, but they remind us this medication carry the risk of the myopathy among the maybe the high risk of maybe myopathy comparing with other statins, simvastatin. Ezetimibe, Zetia, and this medication inhibit absorption of cholesterol from the GI system. Here we talk about GIT system. So which medication inhibit absorption of cholesterol from the GI system? Ezetimibe. We use it for hypercholesteremia, adjunct therapy with the statin. So sometimes we can find two medication in one tablet, a single combined treatment, available as 10 milligram tablet. Evolocumab, brand name Repatha, PCSK9 inhibitor, monoclonal antibody. If someone suffers from inherited hypercholesteremia or like familial hypercholesterolemia, evolocumab will be a drug of choice after using the statin. Someone suffers from atherosclerosis. This patient placed on high dose of simvastatin, and there's no control for the cholesterol. We add evolocumab, Repatha, evolocumab available as subcutaneous pre-filled syringes with the auto injector. So this is the first group of medication for cholesterol. Then we have erlokumab, Brelovent, erlokumab, BCSK9, familial hypercholesteremia. We talk about genetic atherosclerosis, cardiovascular disease, subcutaneous prefilled. Gemfibrozil, brand name Lopid, belong to the fibrate, mainly target the triglyceride. So we need to remember there hypertriglyceridemia. If someone suffers from mixed dyslipidemia, especially we talk about Fredrickson type 2, B, 4, and 5. Gemfibrozil available as a tablet 600 milligram. Fibrate, we talk about phenofibrate, tricor phenofibrate belong to the phenofibrate. Someone may ask about the mechanism of action. You can see here we have a nuclear receptor, and this receptor called PPAR alpha, peroxisome receptor alpha. And this receptor responsible for lipid regulation, PPAR alpha. Again, use similar to the phenofibrate, gemfibrozil. We use it with a similar cases for triglyceride. Again, triglyceride here, about triglyceride and mixed dyslipidemia. Okay. Niacin is like obsolete use now, niaspam, and we don't use the niacin. Limited use now due to the side effect. Isosubent ethyl, isobent ethyl brand name Vaseba omega 3 fatty acid. Um, we use it for severe hypertriglyceridemia. So when you have high level of triglyceride, so we use this Vaseba available as a capsule 0.5 and 1 gram. This will conclude our generic brand name, pharmaceutical category, pharmaceutical forms, and dosage of the medication belong to the cardiovascular system. We have a discussion about antihypertension, medication, diuretic, heart failure, antiarrhythmics, drugs, anticoagulant, dyslipidemia. We have one maybe topic left. We are going to present it by PDF file after this lecture. Thank you so much for your time and have a great day.